Hello, and welcome to the Things I Want My Daughters to Know podcast, the podcast redefining women's health, one unfiltered conversation at a time. I'm your host, Jacqueline Rose, and every week I'll sit down with leading women's health experts and real women to share their lived experiences, bust health myths, challenge outdated and uninformed narratives, and explore what's really possible for women. We'll talk about periods, fertility, menopause, hormones, aging, and everything in between. This podcast is for every woman who ever felt confused, dismissed, or left out of the conversation about her own health. It is a space to celebrate women, break the silence, and open up conversations between mothers, daughters, sisters, and friends. Please hit the follow or subscribe button so you don't miss an episode, and share this podcast with your daughters, family, and friends. Let's get on with the episode. Hello, everybody, and welcome back to another episode of the Things I Want My Daughters to Know podcast. I hope you've been enjoying the episodes. Today, we have a very special guest. I am super excited. I've been following this person for quite a while on social media, on LinkedIn. So I'm a little bit fangirling here. This is very exciting for me to have Bukky. Welcome. Bukky, you do a lot of different things in the menopause women's health space. So introduce yourself, tell us who you are, and then we'll get right into the conversation.
Hello, hi everybody. Hi Jackie, and hi everyone. It's a pleasure to be here. I know we've tried and tried and tried to have this call. Oh, so yes, as you say, I'm Bukky. So I look after menopause support for the workplace at NHS England. And so we do what we do nationally and encourage all of our local organizations to implement menopause support. You know, as it says on the tin, support women going through menopause in the workplace. It started as a retention strategy and has now moved into, the wider wealth and health and well-being initiative of our staff. I do that for the public, for the population, and for staff. But I also found a founder of Vibrant Midlife Wellness CIC. Again, it's focused on menopause support, menopause awareness, coaching, and speaking to Black and brown women predominantly, but we don't exclude anybody. And I also support other organizations as well, to implement a menopause strategy and support. Again, helping women stay in work, thrive in work as they go through this transition.
Amazing. So I know we're going to touch on lots of different topics, and we've got a lot of things we want to cover, but I actually want to start with what you just said, because you said that you specifically focus on Black and brown women in the community, in the workplace. And I think what is very unique about one of the things that you do, which is a real failing of the menopause movement, let's say in the UK, is the way that it is presented as a middle class white woman, heterosexual woman at that, very, very standard, stereotypical image in all the magazines, in all the, there are some amazing podcasts serving ethnic denominations, but really it is, and I don't think people realize how white the menopause conversation is in the UK. So tell us a little bit about that, because I think it's such an important piece of the puzzle that is really not out there enough. I don't think even people understand the nuance of it.
So yeah, so and being aware of the fact that, there are, to your point, menopause affects all women. And I see that, when we go into the menopause area spaces, it's a different way. I have, at least, thank God, I have a bit of a better insight. So what I have just chosen to do is to say, okay, let me serve the women who look like me. Let me and also, the reason I do that, I guess we spoke earlier about my background being pharmacy. I'm also particular in where our women get the information so that they have evidence-based information. using right sources to find their information, because it's a wild west out there. It
Yes,
can be a wild
yes.
west out there, and so it's signposting women appropriately as well, um, because we do need to stick within the evidence. We need to, as much as people might have their opinions or their experiences in their clinics or whatever, the evidence is there for a reason, and we need to at least try and stay on
Yeah.
track.
So can I ask you, and I hope, and I want to be very blunt and open, but I also want to be very sensitive.
Mm,
Women, especially a lot of the information that is shared, is just
mm,
menopause information for women.
mm.
Is there a difference in the way that Black and brown or ethnic women are experiencing menopause versus your, you know, normative white woman? I don't like the sort of the,
I understand. Yeah, yeah, yeah.
I,
So
I want to be sensitive in my language. I know that language may not be particularly sensitive enough, but I hope you understand what I'm
I
saying.
understand. So there are data that suggests that black women, they start to so there's a data point that says, oh, the average age for women in the UK is 51 for
Yes,
menopause,
yes.
whereas in black women, for example, is less, it's 49.6 years. In
Wow.
Asian women, it's even less. So,
Interesting.
having said, so with that knowledge, you then think, you can then infer that women will probably experience symptoms earlier as well. So when they
Yes,
present to a clinician who is not necessarily averse with menopause information, let alone the diversity or the things that
in
happen
different
in
communities.
different communities, you can then see that sometimes if a woman is not well informed and has not armed herself with the right information, um, having a conversation with a clinician who's not that well informed, that might not necessarily go the way she wants. So this is
Yes,
why I say to women, get on board the right information so that you can get to your appointment and have an informed decision, have an informed discussion. You can advocate for yourself. You can
yes,
stand on your truth and say, I know that I'm experiencing symptoms. I've tracked my symptoms, and these I believe are related to perimenopause or
yeah,
whatever. If
yeah,
you're not getting the best outcome with that clinician, ask for a different opinion.
yeah, yeah, yeah.
Yeah.
We also know that women of color and women from different or ethnic backgrounds
Mm,
have other health factors and health risk factors
mm.
that may impact their menopause experience that, again, their doctors or healthcare providers are not aware of. Um, Black women may have more a tendency for higher blood pressure and
Hmm.
things like
Oh,
that,
yeah,
or
those cardiovascular aspects.
so
Yeah.
yeah. So again, I don't want to just paint a whole ethnic community with one brush, but
Mm.
we do know that women of color have other health risks that Caucasian women don't have, and that is going to impact their menopause symptoms and menopause experience.
Most definitely, Jackie. And the other thing to say also is that the psychological symptoms of the menopause, in terms of how black women experience that within that, is also is heightened for,
Yeah,
and there are various factors that the data suggests. It could be, their past, it could be their, the stress of where how they live, their environmental factors, all of those
yeah,
kind of aspects. And
yeah,
so we also, what we did, so that data I talk about is called the SWAN data. And
yes,
the British Menopause Society, they actually, I think they have a fact sheet, I think it's for clinicians, that actually speaks about this topic, so anyone that wants to find that information can find it. But what we also did is we ran a survey with UCL,
mm-hmm.
which is going to be published. Actually, it's going to be published in, because I have the manuscript here. It's going to be published in a couple of weeks, where we
Okay,
also asked women, their perceptions of the menopause, and what came through in that information or in that study was that women were not prepared. So that's why I'm really passionate about sharing this information in our communities to say, you know
Yeah.
what, they were saying they get their information from social media, from friends. We want to change that.
Yeah.
The other thing to say is that the data will there are data that will suggest that women from ethnic communities are not necessarily they are not they're prescribed HRT less versus
Mm.
white women.
Hmm.
For me personally, I believe that that data is not because they are not offered HRT. It may
Oh,
well be that there is a reticence towards
yes.
HRT
A
because of
cultural, a
abs-
cultural
I mean, I'm
element.
I will take myself for example. I'm in this space. I'm a healthcare professional by background, but I consciously chose to manage my symptoms naturally.
Yeah. Yeah.
So I don't that is not necessarily so when people present inequalities and they say black women are less likely to be prescribed HRT, I think we need to look under that.
Under the thing. Yeah.
Yeah.
Look, we also know that in Indian communities that the our mothers' generation
Mm-hmm.
never spoke about women's issues at all. So they didn't speak about periods. They didn't speak about women's health challenges, and so they didn't speak about menopause either. So there's a whole cultural element in ethnic communities that also plays a role here.
I mean, if
Um,
I mean, I take myself for example. I never had a conversation. I mean, I grew up with my mom and three sisters, but we never had those talks at home. No,
right,
and
right.
we never had those conversations at home. I never had. It's now in hindsight because I know my mom used to. She used to take um an oral form of HRT.
Oh
Now that I'm
wow.
in that, I knew that, but I at that time, yeah, we never spoke about it. But I have
Yeah.
those conversations with my daughter. To your point, I have those. She comes to she, I might go if I'm invited out to speak. I'll say, come along. She'll sit there. She'll listen. And some other
Amazing.
younger women in my community as well that I'm close to, they come, they listen, and they take on board this information.
Amazing.
Hopefully, when they get
Amazing.
there and stuff, they at least it was
It's
something
it's sitting somewhere. It's
something would
sitting
say like,
somewhere.
oh, I've heard about this before.
Right, right. So tell me about NHS England because the NHS has, and your work, your menopause work within the NHS England
Mhm.
system, because the NHS system may have quite a bad reputation. Maybe some people have experienced the
Yeah,
inefficiencies or delays within the NHS. So I don't want to paint the NHS, with
yeah.
a terrible, bad,
Hmm.
big red X. But
Hmm.
just tell us about sort of the way that you're working within that system and the work you're doing because sort of you're not out in private, you haven't set up your own sort of training programs. You're actually working within the healthcare system. So share a little bit about that experience and what you're seeing and what you're experiencing through that.
Okay, so my work nationally it sits within one of our directorates called Workforce Training and Education.
Hmm.
And it's recognizing the NHS is a 1.3 million employer of 1.3 million people.
Wow.
75% of those are women. And I
Women.
say women with a caveat because we recognize that there are, trans people,
Yep.
intersex people that experience
Yeah.
menopause at work. But, when I say women, I'm talking about the majority. So 75% represent are women, and of the age range that could be experiencing menopause, it's about 38%. So what before I joined the NHS, what was recognized that this im, uh, implementing menopause support was a retention strategy. It's part
Right.
of it was part of the retention, understanding that 3 in 5 women tell us that their symptoms impact them at work. 1 in 10 women will leave work as a result of menopause symptoms. So,
Yeah.
in terms of we want to keep women in work, let's implement menopause. So we did what we did nationally. We first of all signed the menopause workplace pledge, the well-being of women menopause workplace pledge. We also came out with the national guidance. So that's all of that is my work that I'm talking
Right.
about. National guidance, because it's like having the head of the house, and then you have the different you then so you do what we do. And then we then rolled out about 3 e-learning modules, one for just core module for all staff, then we did a
Right.
separate module for people professionals and another module for occupational health professionals, because these are quite key, because when you have those
Yeah.
conversations in the workplace, those are the kind of people you. We launched the self-care fact sheet. Again, that's for all of, well, most of our resources are available in the public domain. But we've done what we've done nationally, but a lot of our local organizations, they've done phenomenal work in the menopause space. A lot of
Right.
It's just that what we do at the NHS is brilliant. What we're not so brilliant about is telling people about it. On the other side, there is also obviously the clinicians and my colleagues, GP colleagues, they get a
Yeah.
bad rap. Oh, I went to my doctor, he didn't know this. I went to my doctor there. But honestly, there's a lot more because of the conversation, because the
Yeah.
conversation is much more out there. A lot more GPs are becoming menopause aware. So my background is pharmacy, so I am
Yes.
always sensitizing pharmacists, because they are a key group that can help at primary care level as well.
Yeah.
And then also there's a lot of nurse prescribers as well. So there are different aspects, different professions that can support in this area. Um, and okay, so I know that practice nurses, for example, we within the NHS, it started from LinkedIn. Somebody said, "Oh, sign the petition." I said, "Why would I sign this petition?" Because I know that the work that we're doing is to empower the workforce. So I went back into my colleagues who are in nursing. I said, we need to pay attention to this, because the word on the street is there's nothing available for practice nurses. And then we came up with a framework for them. So that exists. The Royal College of GPs in September 23, I believe, they launched a whole e-learning module for GPs, a menopause e-learning module for GPs. So that's there. Pharmacists, I know that they have their own module as well. And with
Amazing.
Menopause Research and Education Fund, so that's Fiona Clark
Yes.
and Dr. Vikram.
Yes.
We are also just at the moment we're putting together something that we will roll out for pharmacists come
Oh,
2026 as
amazing.
well. Yeah, because we I said, okay, let's go and ask them. We went and asked them. They said yes, we want this, and so we will. So it's just the momentum is building slowly. But
Amazing.
if people don't know, they can only speak from their experience. I went to my GP, I couldn't get what I wanted,
Exactly.
and that's
Yeah.
that's
And then it's
where
like the NHS
no.
isn't helpful. And yeah.
And with the women's health strategy that is going to have a refresh. I'm sure menopause will feature in there in the way
Yeah.
that all the local hubs are coming through. I know I was with a colleague last Friday, actually. He's in Leicester. He runs a hub in Leicestershire. And they run. I was sat there with him. He was doing his clinics. So people are doing great stuff. It takes a while for things to change, but things
Yeah.
are moving in the right direction.
Well, that's really good to know. I want to ask you two things about this topic. So, the first one is that the NHS now has these new menopause questions that are
Hmm.
going to be included in the regular sort of wellness checkup with your
Hmm.
GP. I want to
Hmm.
know a little bit more about that.
Hmm.
And then you can prepare, because I want to ask you about menopause being included in the Equalities Act as sort of making it more of a legal status within the workplace. So let's firstly talk about these new menopause questions that are going to be part of your doctor's sort of standards
F.
checkups. Yeah.
Yeah.
What could women expect? What are they going to be asked? How is this going to be? You know, is there
So
a standard questionnaire? Is it up to every doctor's discretion? How is this going to manifest?
So I wish I could tell you, Jackie. So basically, when the headline came out, because the headline, so at the moment, you heard, I think you must have heard, I don't know if everyone heard the Prime Minister's announcement that NHS England is abolished. Anyway,
Yes.
so
Well,
that's where we are. So there's a lot of flux going on at the moment. However, when this announcement came out, it came out via the Department for Health. And yeah, I looked at it and thought, well, great move, because I know Menopause Mandate and Carolyn Harris and that group,
yeah.
they've been campaigning and advocating for this for a long time. So I thought, yeah, sharp move, great move. But I look at these things beyond the headlines, to be honest.
Thank
So
you.
okay, let me, beyond the headlines, let me send an email and ask, what exactly, how is this going to unfold? What does it look
Yeah.
like? Well, all I
What does
can
it look
say,
like practically for the woman who is sitting across from her doctor?
what is it going to look like for the woman? What's it going to look like for the workforce that's going to implement? All I
Mm,
can say is right about now, it's a work in progress.
okay. Okay.
It is a work in progress. The commitment's there, but how it unfolds, what it will look like, and it is a work in progress because even the week we're coming into, I have a meeting to discuss this exact thing. So it's a
Okay.
work in progress, but to your point, it will manifest hopefully nicely for everybody.
Okay. So we're still not yet sure if the doctors are going to receive some type of standardized questions, if it's up to every doctor's,
Oh no, no, no. I
discretion to
know
ask.
it will probably be. Let me not
Yeah.
speculate.
Okay.
Let me not
So we
speculate.
know this thing exists. It's in
Yes,
the headlines, but thank you for digging under the hood, as they
yeah.
say, to really tell us that at the moment, you're not quite sure exactly what it's going to look like.
It is a work in progress, but
Perfect.
because that commitment's out there, it should manifest in a good way.
In a good way. Okay. Now, I want to challenge you a little bit
Hmm.
because I am in two minds about how I feel about menopause being recognized in the Equality Act and sort of what that means for women. So I'll just give a very brief synopsis for our audience who may not know what we're talking about. But in the UK, menopause is being included, and please correct me wherever I'm wrong with my information. Menopause is being included in the legal sort of definition of protection under, is it the Equality Act or,
So, my understanding is that it's going to menopause action plans are featuring in the employment bill. I
okay,
don't, I'm not entirely sure it's the Equality Act.
okay.
It will feature
But
in the employment bill where from an equity standpoint, this government are saying that organizations that have over 250 employees should to speak to having they should have menopause action plans so
mhm.
that they speak to how they will support women in the workplace. That's what I'm aware of.
Okay, but I think that the law is going to recognize menopause as
Protected
a
characteristic.
yes, exactly, as a
It's
protected
that's
uh,
interesting.
disability or as a protected under a certain category where it will be
Ah,
protected, similar to things like pregnancy or disability.
I be okay. That I will have to
Yeah.
look into that slightly further because what I've paid attention to
Okay.
the the employment bill, but
Okay.
not this aspect. So I will
Okay.
have to read up more on that if I'm honest. But tell me, what's your take on
So
that?
my challenge about this is, and again, I'm in two minds how and I can argue it both ways.
Okay.
So, but let me argue the sort of the more contentious side of things. The minute you put into legal jargon
Mm,
of a protective nature, women
mm,
in menopause in the workplace,
mm,
does that then become an element where you're sort of it's room for potential discrimination? It's room, the minute it's protected, what does that mean about menopausal women? You're sort of putting it in a status that it needs protection,
mhm,
whereas you're sort of claiming it as some type of health, female health situation that we
mhm,
need to. And then does that mean that employers are going to have to abide by certain regulations, abide by certain recommendations, and therefore they may say, "What do we need this for?" I don't want to employ a menopausal woman if that means I have to now start implementing
mm.
all these
These various
recommendations and
things,
all
yeah.
these guidelines and all these
Mm,
things. I can go ahead and just employ younger women and not have to deal with any of that. So, in its essence, it is there to protect the menopausal
mhm,
women. But I
mhm.
wonder if there's like a 180-degree turnaround where could it backfire on us?
And so that's valid thinking. But having said that, if we've left people to do what they're supposed to do all this while, and women organizations are not necessarily implementing the right support, or a woman not necessarily having that flexibility, or in certain ways, if we write it into, to your point, into legislation or whatever, even the younger woman is going to get to menopause, remember.
Yeah,
So
yeah,
I honestly think, um and the UK is not, it's not like other countries where you can just do things off the fly. You go by the rules. There's unions as well that
mm,
protect people in work, etc., etc. Because for those people who need the support and are not getting it, what do
yeah,
they have to stand on? So
yeah,
I see it in a way that it will make employers wake up and pay attention. And
okay,
it might initially have that effect, but if that's called out as well, you
yeah,
know hopefully it will move in the right direction, where we recognize disability, we recognize pregnancy, we recognize you can't discriminate by somebody's faith, or all of those kind of
yeah,
aspects. So
yeah, yeah.
yeah.
I accept that. I accept that. Yeah.
Okay.
Bookie, tell me, you started off your women's health journey, your professional career as a pharmacist. You were worked as a pharmacist for a long time. How do you see that infusing what you do now? How does that inform what you do now in terms of women's health, menopause, hormones, HRT, the role that pharmacists play in that? Sort of how has that professional time of your life helped you or guided you or informed where you are today?
So yeah, I've been a pharmacist a long time. I've not necessarily practiced pharmacy for the most majority of my career, but whatever
Right.
I have done has always been in this healthcare space. It's always been supporting women, to be honest. If I and I so But my journey has been, I've done a bit of retail pharmacy back home in Nigeria where I qualified, but majority of what I've done in the UK has been within the pharmaceutical industry. So when I talk about
Ah,
evidence base,
yes.
I'm hot on that, because that is that is my background. So I bring that to what I do. When you talk about information sharing, you always are making sure that you're sharing what you can corroborate, what you can substantiate, because
Yeah.
that's my background. I'm passionate about the profession of pharmacy, because I know that they're highly skilled professionals, because there's a very, very little scope for error in pharmacy, if I'm honest.
Yeah. Yeah.
And so, and they're especially community pharmacists, pharmacists in hospital, pharmacists in primary care, they're at the coalface. And now that the NHS is, the 10-year plan and the 3 shifts that the hospital to community, pharmacists are well placed to
Yeah.
support women in this space. And not because I'm partial to pharmacists, I just know the skills they have, um,
Yeah.
the zeal and passion they have to make people, to help, to support
Yeah.
people's health and well-being. Yeah. So,
Yeah.
and I
And
would
I think also pharmacists are probably well placed to assess side effects in ways that maybe doctors aren't.
side
So,
effects, the ways of counseling patients, all of those skills that they bring to the
yeah,
fore, absolutely.
yeah,
Looking at all, a person's different medications. The other thing that I also did was, even though my background's pharmacy and all of that, when I moved into this space, I actually took a health coaching certification as well.
mm,
Because again, when you use coaches, so I knew that I could counsel patients, but I thought, you know what, I just need a bit extra. And so when you use a coaching methodology,
yeah,
that's also quite helpful for women to walk
yeah,
alongside them, to help them find their solutions and help them walk alongside them, keep them accountable, all of that kind of
yeah.
aspect.
Cool. I am wondering whether I want to ask you about the evidence for HRT, the research that is done by pharmaceutical companies, and whether I sort of want to scratch that itch of sort of, as a pharmacist, and you're talking a lot about
Mm-hmm.
evidence-based information and evidence-informed information.
Mm-hmm.
Um, there often is criticism that, firstly, there is not enough research done in women's health. There's not enough research done in, menopause. There's not enough research done in the impacts of hormones.
Mm-hmm.
And the research that is done, is it tainted by the people who are paying for the research?
Mm-hmm.
You did mention Fiona Clark's menopause research and education fund, which Fiona's been a guest on our podcast, and they do amazing things.
Mm-hmm.
Do you want to talk about the sort of research side of things? Do you want to touch on that?
So I would say, I mean, HRT is the most recognized and licensed medication for treating menopausal symptoms.
Yeah,
And in order for any drug to get a license, they must present studies to the regulatory authorities. So
yeah,
I mean, that's just standard practice. What
yeah.
I would say is, I heard, I think it was Vikram actually that said this at one function that we were all at, that majority of menopause studies are done in white Caucasian women.
Right.
So I will come at it from that perspective. And that's
Yes,
number
please
one.
do.
The other thing to say is that, to your point, I and that that a funding for women's health studies is quite low, and funding for menopause studies is even lower.
Yeah,
So what I would be saying to people, and I've actually I've tried uh ask Fiona to say, okay, the research education fund, what is the focus, what is the focus, or at least the initial focus of research? Because I'll be interested to know that, to be honest. But what I
yeah,
would say to researchers is, yes, when you do get that research money,
yeah,
try and spread across the board the cohorts that you are testing, so that, yes, we can at least have a representative thing. The other thing I would also say is that women in the Black community as well, is to sensitize them, or not even just black and brown communities, is to sensitize them to become involved in research. Because when
mm,
we did our survey, as an example, it took us about 12 months. We were out there calling for people to become involved, and
wow,
we got very few responses. Whereas the similar survey in the Caucasian community, in a short space of time had thousands of responses. So
Fascinating.
it just gives that perspective. So in as much as we say the research is there, I also say let women move towards what's going on as well. Let them become
Yeah,
part, let them become involved, because if we don't share and lend our voices,
yeah, yeah.
that we don't have, no one knows our perspective basically. Yeah.
Yeah, yeah. And it sort of becomes a double-edged sword. Like there's not enough research out there amongst all different, female
Groups.
demographics. And at the same time, you don't have the information to be able to share it with
Yeah.
members of those communities, sort of to have representation.
Yeah.
And it sort of becomes, a vicious cycle, I guess. So that's a fascinating point. That even though you've got the lack of research is also not just overall research, it's also,
Different
um,
nuances, yeah. So Asian women, are
nuances.
they
Yeah.
represented in your research cohorts? Are Black women, are South Asian, East,
Yes.
different
Yes.
perspectives, yeah.
Yeah.
There's more talk now, there's talk about women in prisons, there's talk about the LGBTQ community, there's talk about, women with disabilities,
Yeah.
let's make things a whole lot richer.
Yeah. But that makes the conversation more nuanced. You need to be able to hold a lot of different thoughts in your head at one
Hmm.
time. And isn't it so much easier to go on a talk show and just talk about the standard typical menopause experience and just assume that it applies to every woman equally across the board? As we come to the end of our conversation, share with me a little bit about your vibrant midlife work and what you've created in that space.
Whew, yes. So Vibrant Midlife. So we launched this. I launched this in the pandemic. So I launched Vibrant Midlife in the pandemic. Long story short, as I said, I worked in pharmaceutical consulting for many, many, many years,
Right.
within the pharmaceutical industry, and I just came to a stop in 2019. I thought, you know what? I've done this now for so long. I need
Yeah.
to just figure out what it is I need to be doing for the rest of my
Yes.
life. And long story short, I came to a situation where I thought I'm going to still work in healthcare. I will work with women. I'll work with women of a certain age. And so I took time out and came back. When I came back in January of 2020, um, I worked with a career coach, took time out and came back and thought, okay, I've had time out. My head's clear. Let's go back into what I know, pharmaceutical consulting.
Right.
But then the pandemic hit, and so there were
Right.
no contracts, there was no work, there was nothing, and I
Yeah.
was just there doing nothing. And so
Yeah.
when I'd worked with this coach, I'd written out a plan that, this is what I'm going to be doing. So when we were all sat stuck at home behind on Zoom,
Right.
that's when I started, talking to women. I did the health coaching certification, and then I
Yeah.
started talking to women, coaching women, just coaching women myself and doing all
Yeah.
of that. And I did a whole lot of, I did many, many, many Zoom sessions, recorded sessions, on
Yeah.
different topics. So because I have a holistic approach in terms of, so I talk about menopause, I talk about symptoms, I talk about managing physical symptoms, but I also talk about, what's your finances looking like, how are you coping with
Mm.
stress, what are your relationships like? So we
Yeah.
talk about all of those kind of aspects,
Yeah.
what foods support you, all the well-being pillars, basically, your
Yeah.
nutrition, your exercise, your sleep, your stress,
Deep.
your
Yep.
substance use, and relationships, all of those kinds of things. So, and then I when Vibrant Midlife is an evidence-based, but it's a faith-based practice. So we bring all of that aspect into what we do.
Mm.
And we did a lot of online, but our women, at some point became fatigued with online.
Yeah. Yeah.
Became fatigued with online. Well, women just like to connect. So some of the things I've done a couple of workshops, and I kind of keep them kind of small because apart from we come together to talk about menopause, I like women to interact, to
Yeah.
network so that they can do
Yeah.
things together, learn from one another, support one another. And that's what we're trying to do. So we've done that. And then last summer, I had the first our first Vibrant Midlife Summit, which was in London, which was it was well attended, and we're planning another one coming up next year. So
Yay. And you also released a journal. You published a
yes,
journal
so I
also.
have a Vibrant Midlife journal. Again, it's I call it a wellness and affirmation journal. So in that journal, it covers lifestyle pillars. So I'm one
Mm,
that I like to talk to women, but I want women to take action.
yeah,
And so this it's got a weekly pillar that's, is an activity to do. We've got affirmations in there. We've got verses in there. We've got, just words that build
amazing.
people up and people can, and then, every day you capture your gratitudes as well, because that's an evidence-based wellness practice. So yeah. And what we also do is, as part of our CSR, is we um, send journals to women in prison.
Oh,
Um,
wow.
yeah,
Fascinating.
yeah. So we send journals. So up until I think the past three Christmases, we've sent journals to women in prison. But this year we'll be sending journals, and we'll be sending the understanding menopause booklet. The booklet from Diane's
Stand to
from
break.
menopause support, and when we were at the Inequality APPG, just I think it was last week or the week before, Carolyn Harris spoke about she's got something that she's done. She's got a bookmark that she's prepared that talks about menopause. So I'll get some of those and send those along, because at that meeting it was so heartbreaking. Somebody
Wow.
shared her testimony about how she had been in prison, and when she went in, her HRT was taken away from her. So when we talk
Wow.
about women out on the outside not accessing information, it's it's terrible for women in prison. So yeah,
Wow. That sounds like such a fascinating area. I'm not going to open up that Pandora's
yeah,
box now, but that is something that sounds like a fascinating area of work
yeah.
that,
So
again, you wouldn't even think about.
so why I did that, why I thought about sending the journal into women in prison is very, very way, 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 way back. I used to go into prison as part of prison ministry.
Mm.
So so,
It
and
was
when you
in
talk
your
about
consciousness.
it was in my consciousness to think, what's going on with these women actually in this menopause conversation. So that was why I
Wow.
thought, okay, let me send this to them. And then, yeah, so it's becoming more, it's unfolding a whole lot more for me. Even today, I was out
Wow.
with one of my colleagues. She's a consultant. We just she just sent me a message and said, "Oh, should we hang out?" And she wants to do a lot of work with women in prison as well, because she sees them. The prison that she works, the prison is quite close to them. So actually, she sees them as patients.
Right.
Some of
Right.
yeah. So yeah, it's
So I guess I'm just going to ask one question about that. Can women in prison access HRT, or is HRT not available in prisons? Or is
um
that a complicated question?
I believe they can, but
Right.
it's in the way that the appointment system runs in prison. The access is
Right.
quite tricky,
Right.
is what I
Right.
believe. Yeah,
Wow.
it's
Fascinating.
it's
Fascinating.
honestly, I sat there listening to this lady, and I just thought, oh my God,
Yeah.
the things you take for granted.
I mean,
It's
the thing I'm taking from you, and I hope everyone listening is taking from you, is that menopause is often presented, as we've said, as this
mm,
one size fits all,
mm,
this one demographic,
mm,
a one
mm,
woman experience.
mm,
And we always say that it's very personal. Every woman has her own personal menopause experience,
mm.
but it goes even deeper than that.
Much
It's
so,
that
much
it's
so.
not just that every woman has her own menopause experience. It's that
Mm,
we've got to look at different demographics,
mm,
different communities, different
mm-hmm,
ethnic backgrounds, different
mm-hmm,
cultural languages. All
mm-hmm.
of these things play a role into how a woman may go through her menopause journey.
And that inequality report, for example, it's there, that well-being of women joined with the APPG, and they've produced that report. So it's tangible for people to pick up and have a look at
Yeah.
and say, okay, what can we do? And I believe There is, I mean, because that meeting, the women's health minister was there, Dame Leslie was there, Caroline, she's the chair of the APPG. There's that commitment at that level. And I know the minister was saying that she had spoken with West Streeting. So I believe the commitment is there. But as with everything, let's not talk about it. Let's talk less and do more. That's
and do
what
more.
let's talk less and do more, and that's what we just want to see the action take shape now.
Yeah. Well, I think that's a great way to end our conversation. But as you know, because I mentioned it to you and all of our listeners will know, I always end conversations by asking my guests, this is a podcast of things that I want my daughters to know.
Hmm.
What do you want? You said you're a mum of a daughter. What do you want your daughter, your goddaughters, your nieces, that next generation of women? What is it that that you want them to know?
So I would say, daughters are they're younger now. They is to be period aware, to get on
Yes,
board with period information, and to your
yes,
point, cycle tracking and all of that kind of aspect.
yes,
Understand the pillars that support them at this time. Become menopause informed,
yes,
because it's not just impacting their mothers, it's probably impacting their colleagues at work,
yes,
it's probably impacting other women that they meet in their lives.
yes,
And when they become menopause aware at this stage, as they approach, they're in a better place to
yes,
to manage and understand what's going on with them as well.
yeah.
So it's for them and
Amazing,
for others.
amazing. Vicky, this has been wonderful. It's everything I hoped it would be. I know we touched on lots of different topics.
Hmm.
Tell the audience where they can find you. Where are you hanging out? Where should people come to hear more and learn more about what you do?
Okay, so as you say, I hang out social media mainly for me is LinkedIn. So I'm
Right.
Bukky Ayoade on LinkedIn. Um, Vibrant Midlife Meno on Instagram. We have a little channel, Vibrant Midlife TV on YouTube. So
Wow.
yeah.
Cool. Well, we will definitely link to all of those in our show notes. So anyone who wants to follow Bookie, please do that. I really love everything that you've shared with us, and I really hope that it's so amazing to hear what is going on in the NHS,
Hmm.
even if it is a little bit hidden and we're not talking about it enough. But the fact that you exist and you are doing this work is very hopeful and inspiring. So
Thank
thank
you
you,
so much.
really.
Thank you. And what I will also do, I'll share a link with you. We have a little, I talked about a little guide, coping with menopause symptoms in work or business. I'll share a link with you.
Mm,
So if people want that,
perfect.
they can download that as well.
Amazing. Fantastic. So everyone go to the show notes and get all the links to follow Bookie and to get that download. Thank you for joining me today, Bookie. Thank you everyone for listening. And this really has been a powerful conversation talking about menopause as we love to do from a slightly different perspective. So join us for another episode on the Things I Want My Daughters to Know podcast, when we will be diving back into the world of women's health and menopause. Looking forward to seeing you at the next episode. Thank you, everyone, for joining me today.